Hello and welcome to Filibusters in Fine Print, where AMGA's public policy team gives you the insider view on healthcare regulations and legislation. Thanks so much for joining us for the latest from Washington, D.C.
Good morning and welcome to Filibusters in Fine Print, AMGA's public policy podcast, where all the healthcare news is fit to print. I am Chet Speed, your host, and I'm here with AMGA's all-star staff. Today we'll start on our left. So if you all will introduce yourselves.
Jamie Miller, Ambassador Goodwill here at AMGA.
Alicia Sawyer, Government Relations Assistant.
Lauren Lightning, Director of Government Relations.
Thank you all for being here. We're not going to do a question of the week again, as you heard last week.
We're told not to have fun.
Yeah, the AC, right? The air conditioning is still out, so it is 82 degrees. And we're just going to go right into
a hot topic.
That awful.
We should do ice baths next time.
Miss Latney's very happy right
very
now.
happy.
And Mike, our producer, is laughing also. So.
I just exist to try to see if I can get Mike to react.
Oh, he's cracking. Yeah, he's definitely. It's more like a smirk too.
Yeah, it was a smirk.
So it's a little,
yeah.
It's interdepartment rivalries,
yes.
More Congress and policy. All right, I'm literally sweating. Okay. So today we're going to talk about headwinds. I assure you there's no headwinds in this room.
No.
We're going to talk about headwinds for all MG members, but when you look at the policies that Congress and the administration is pursuing fairly actively, I think the headwinds are more impacting health systems and independent medical groups. But it's important that we talk about these headwinds because they're going to come to they'll be scrutinized in 27, and it's important that we understand where we were going in 26 so we can lay the groundwork for what we're going to do next year. With Ms. Latney, you started with that awful joke.
Oh, so bad.
Yeah, it really was. Let's talk about the policy environment and where these headwinds are.
Now you're talking about starting in 2027, where we're kind of seeing it now, right? You're looking at healthcare spending, it continues to grow faster than inflation. You're looking at the Hill environment right now since the beginning of this year. I think there's been 4 or 5 congressional hearings in both Ways and Means Committee and Energy and Commerce Committee. Ways and Means, they do the tax element of Medicare and as well as GME, also Medicare Part A. Then you also have Energy and Commerce, who does whatever they want. They've had hearings with insurance companies and healthcare system CEOs and hospital associations and independent groups and pharma and supply chain management, all under the discussion of why is healthcare unaffordable for people, and not unaffordable for the hospital systems who are trying to run these complex programs under a rapidly diminishing reimbursement environment. But what does it look like for patients at the point of service, what comes out of their pocket? And so we're looking at that. Policymakers are always looking at how do you save money in the government. That's always a hot topic. I can't believe I just did this again. But it's always something that's been discussed, particularly among Republicans, of how do we look for savings in the program, particularly because we just cut $1 trillion out of it.
And so let's do some more.
Yes. Healthcare consolidation continues to be a bipartisan concern. This comes up in every hearing that has some sort of healthcare jurisdiction. If it's Aging Committee, if it's Joint Economic Committee, this is coming up. And then also there's a lot of more public scrutiny around affordability, not just within their healthcare services, but food, gas, all these things are coming up. So they're where is our breaking point? When do we get some sort of relief?
Yeah, you can't hear a member of Congress not say affordability
right.
with your RRDs. And I think I saw on Instagram, so it has to be true, that healthcare costs are now the number one concern for Americans.
Yeah.
And obviously Congress represents the people in a way, and that's what they're, yeah.
Lauren, you remember when Chick-fil-A meals were $5?
Remember when there was $5 foot longs?
That was a good time in my life.
Good time to be alive.
It was.
The kids weren't there. Well, you were there, but the other kids weren't there.
I remember the $5 foot long.
Subway?
Yeah.
Oh,
It's
okay.
not $5 anymore. It's a
No.
solid 12.
Yeah, it's like $12. And you're like, really?
Really?
I do the grocery shopping for the family, and it's $200 every time. And
Oh my gosh, yeah.
And you can see why the concern is for members about that and healthcare.
Yeah.
Okay, so if we were to advise our health system executives and group practice executives, what should we paying the closest attention to policy-wise this year and next?
Well, you're looking at HR 1, the One Big Beautiful Bill Act that passed last year around this time, which is sort of crazy that an entire year has passed since that has been.
Almost,
yeah. And you're looking at the implementation of $1 trillion cuts in Medicaid, also Medicare cuts. There's no stable reimbursement factors within Medicare. There's a lot of concerns right now around what's happening with state-directed payments as well. You've got increased congressional oversight on hospital finances. They want to see the numbers. You have a lot of different regulatory things that are coming out of the Trump administration that looks at the future of like 340B, future of site neutral payments, also the introduction of prior authorization within Medicare. You're seeing a lot of experimentation around that. If you listen back to our previous episode of Willing and Able, we talk a little bit about what we think is happening at CMI and what that looks like. Also, just go back and listen to it. And then
it's a good one because we weren't on it. It was just Lauren and Daryl.
I didn't want to say that.
The two divas,
but
Diva
the
2?
Diva 1 and Diva 2 showed up.
I feel attacked. I don't know
Well, you should be.
You were
because-
on assignment, is what we called it.
It's on assignment.
You were helping AMGA in other ways.
Yeah.
Yeah.
Portland.
Yeah.
Let's do this.
Let's
I was
do
on
it.
vacation.
Yeah.
You
See,
helped
I
me
was
too.
not gonna. You were on assignment to enjoy yourself, which is also
Thank you.
important.
Okay.
Yes.
To support team morale.
To support team morale. Yes.
That's what I do. That's a leader.
That's a leader right
That's a
there.
leader.
Yeah. We also have an election year that's coming up too. And so you're thinking about headwinds. Who's going to be in charge next year? Who is going to
Great
be
question.
implementing some of the policies that might make or break, or maybe do a little bit of both when it comes to healthcare systems as well? A lot more scrutiny, a lot more oversight, but also maybe some support for some tax credits for folks. So there's a lot of things that are facing our healthcare systems right now, and we're on the lookout for them.
Lauren, you remember we were on the Hill a few weeks ago. We met with a bipartisan group, and they were like, well, when the Democrats are in charge, the Republicans are saying, so we're not going to say which ones, but like they're preparing for potentially losing the House.
Yes.
Yeah, it's so we're friendly to everybody.
We have to be. It's good
Yeah.
to be friends with
We're
people.
nonpartisan.
We're nonpartisan.
Ambassadors of goodwill, as someone
as
might
someone
say.
said.
Thank you so much.
Yeah. So there is a lot happening, and we also have a very narrow time period this year. You know, we're in July. August, the members go home to hopefully tour facilities, but then they come back in September for funding of the government, which they won't do. They'll extend that to December, and then November's the election. So there's crunch time that's happening right
Be
now.
off most of October.
Yeah, so
yeah.
not a lot of actual working days in a Congress that has not passed a lot of bills.
And that's exactly right.
Yeah.
Which is why we say it over and over, 2027 is going to be so important.
Right.
Because that's when these issues are going to be under scrutiny,
Right.
and they'll probably come to the House and Senate floor.
Yeah.
So that's why we got to talk about it now.
Yeah.
Great. So, Jamie, congressional priorities. What we just said that healthcare legislation in 26 is unlikely. 27, 28 are going to be the big times. Where is Congress going to focus its attention on healthcare issues now and next year?
I'd say now, between now and the election, there's a lot of discussion about affordability. As Lauren mentioned, there's a lot of hearings. Depends on who controls the House next Congress, if they'll address an issue of AMGA's that we value enhanced premium tax credit. But they're just last, well, I guess 2 weeks ago now when this comes out, the HHS came out saying that 3 to 4 million people are less enrolled in Affordable Care Act plans. And HHS official reasoning for that is there's phantom beneficiaries and they were taken off the rolls. Other people, health policy experts, would say the expiration of certain subsidies in the Affordable Care Act enhanced premium tax credit led to loss. So there's going to be 3 to 4 million people who do not have health insurance, and so they're going to be voting. So Congress is trying to react to that. Medicare physician payment is a big issue. We've been working with a MACRA task force within AMGA and also with the GOP and Dem Doc caucus. They've been very active on MACRA reform, and we've been supportive of their inflationary updates to Medicare, reframing of MIPS, the APM reform they're working on, and in general, they've just been a great organization to work with. And Laura and I have met with Senate Finance, House Ways and Means, House Energy and Commerce leadership, and this is a bipartisan issue that I think a lot of people are willing to work on together. Medicaid implementation oversight, not as bipartisan, but as Chet mentioned, 2027 is a special year. But we're already seeing rules coming out of the administration that we need to be aware of, like with state directed payments or the work requirements. And I know AMGA's been interested, and our members have brought up to us the documentation of medical frailty. We've heard from a lot of our members about that. So you need to be involved in that. Fraud prevention, there's been a lot of attention to fraud prevention. There's been a lot of hearings. We're not sure about the actual legislation, but there could be certain guardrails around telehealth or other types, or chronic care management, just ways we need to make sure that, and as Daryl's mentioned, who's not here right now, but he's mentioned before that we need to eliminate fraud, but we also don't need to create another impediment for our physicians to provide care. So got to be careful how that works. Transparency. There's a bill that's mandating you put hospital prices on the wall.
The little wall?
On the wall?
Yes.
On the wall.
They got to be posted on the
Yeah.
wall.
How big is this wall exactly?
Yeah, I don't think they're going to put the charge master.
8 fonts.
I know.
But there's also been a lot of discussion about 990 nonprofit reform, and certain tax writing committees are looking at nonprofits provide how much community benefit they are providing and whether or not they deserve the nonprofit tax status. And we've also heard a lot about consolidation. So there's so many things going on right now.
All right, and I'm going to sum up a little bit in the middle of our podcast. But so the headwinds are, especially for health systems, it's 340B, it's site neutral, it's potential 990 reform, and that could be, if they start taking away their tax status, that is a huge issue. Transparency, of course, and on the sort of plus side, there's a meaningful attempt at Part B payment reform, which obviously AMGA has been hugely involved with, and congratulations to all of you for making those connections, as well as telehealth. A lot of support for extending that permanently, or as we all say, for 10 years. So we have headwinds, we all have some tailwinds, particularly around the Part B side of things. Is that fair to say?
Yeah.
And
There's definitely been a shifting of conversation around substance around Medicare payment policy, in ways that we haven't seen since MACRA has been enacted. There does seem to be a lot of energy there. There seems to be a new batch of staffers who are kind of looking over what are now historical documents.
oh God.
They're doing this research and doing this historical research of how these bills were drafted because they weren't around when they were, and really, I think asking really great questions of what structures work within this, which ones do not, and really curious from our perspective, from our members' perspective of how to improve this, which is it's really exciting because members, you're seeing that reflected in their questions in some of these hearings.
Yeah, it's great because we have 10 years of data experience with MACRA, and it did not meet expectations, especially around transitioning Part B to value.
Right.
And there are what we feel is obvious reasons around it.
And Chad, I think you summed it up well. I would just add that when it comes to the end of the year, and this is legislative jargon, but there's a lame duck session, and that's probably when a lot of these pieces of legislation could be and might be passed into law. And so we need to be ever vigilant. As Lauren mentioned, they're in session in September, out in October, they'll be back in November. We need to make sure that any legislation passed will obviously be helpful to AMJ members and their patient, but don't blink, because they're going to have some massive healthcare bill at the end of the year, Christmas time. We had one in 2024. Elon Musk stopped it for other reasons, but that's something that we will be engaging, and I know Alicia will engage you as well because of grassroots and other things.
Oh, absolutely. I expect to be getting notifications from the AMGA Grassroots Network and seeing it in e-news. If you receive our newsletter, it'll be populated there as well.
Great. Well, Alicia, while you're at the mic, let's talk about the elections.
Happy to.
Thank you.
Oh, no, sorry.
Please go.
No, I'll let you ask the question.
I like the energy that she's been bringing today. She's happy to. Let's go. Let's hit it.
I'm ready to get out of this hot room.
It is. All right. So how do the approaching midterm elections influence healthcare policymaking?
So I did some of my own research on this, aside from Lauren's brilliant outline, just so I could have a...
I wrote that in.
Yeah, she probably did.
It was only in my copy. I don't know how.
Yeah.
But this plays a massive, massive role in healthcare policy making, as well as all of these things are all connected. And so healthcare messaging, we're going to see that become increasingly more political. Democrats are attacking Republicans for allowing the expiration of the Affordable Care Act enhanced premium tax credits and using that to blame them for the affordability crisis. And so we're seeing shots fired on both sides. As in that vein, passing major legislation becomes more difficult as posturing becomes more important. People are less willing to work bipartisanly and more concerned about how that impacts their image, whether then important legislation is going to be passed. And if the House flips, we might be seeing a lot more oversight hearings, seeing that become a lot more frequent as the Democrats take a look at what's happening under the Trump administration.
It's also fascinating because there was a bipartisan bill, a housing bill,
Right.
that everyone was like triumphing, and they're supposed to do a big signing at Statuary Hall. Then a tweet goes out. President Trump's like, I'm not signing this.
Yeah, called it a big yawn.
Yeah. But it seems like it might get signed. If not, this might be one of the few overrides we will see of a veto by the president if it does not get signed by the president in terms of like, let's pass housing legislation. So there's energy there, but there's also, who knows, like we lost our 2024 bill because we might lose other things because of tweets as well.
And executive actions become more important if the House flips or the Senate flips, because then there will be one chamber blocking. And so we'll be seeing a lot more executive action. The current outlook, though, the House appears highly competitive. Currently, there's a tiny GOP majority, and there are a few seats in play, but there's a big impact being felt from redistricting. And even if California is able to redistrict and even out the seats gained by Republicans in Texas, it may not be enough.
What's that thing called? The prediction markets?
Yeah.
Like Clashy and all
Clashy,
that.
yeah.
Right,
Yeah.
So they and they have it 75% likely that the Dems take the House,
Yeah.
and a little less than 48 for the Senate.
Wow.
Prediction markets, right? That's what
Yeah, that's what it's called.
Want to make money.
They bet it, big bets.
Big bets on politics.
It's all about the money.
Yeah.
And I mean, on money, Republicans are spending a lot in this election. We're seeing major PAC donations on their side.
Yeah, and being competitive in states where they normally haven't been competitive, right? Like Texas is right now split in the middle between Kim Paxton and
really?
Tallarico. They're 47%. Something we would never have thought about in the past, but like the money that's going to have to go into Texas in order to pull that out for a GOP means money from other states will not get as much. And also you think about Dems. Dems are fighting within Dems themselves as well.
Which Dems do.
Yeah. We
It is amazing.
love an internal battle.
It's
We hate from inside of the club.
You do.
So you have like major in Colorado right now. There's competitors
gosh.
in
Yes.
Colorado.
Yeah.
Yeah, and so to get the Senate, Dems need 8 out of the 10 seats to flip. They need to defend Michigan, New Hampshire, Georgia, and Minnesota. Georgia and Michigan, I believe, both went for Trump.
Mm-hmm.
No, maybe not Michigan.
I think so.
Okay.
Yeah, both of
They
them.
both went for Trump, so that's going to be an uphill battle and really interesting to see how that plays out.
I don't know. With Georgia, John Ossoff, people are like, this man's going to run for
They're like,
president in
yeah.
2028. He knows how to clip a video.
Yeah.
And that's what we need to do as our president these days.
Yeah, clip videos.
You
Yeah.
need to have a good online presence, all right?
He does.
It's increasingly important with Gen Z.
Yeah.
His
Start
wife's,
talking about
his wife's a doctor.
farming, I'm
Yeah.
leaving.
John Ossoff has aura.
He has, yeah.
Aura
that out
farming, whatever that is.
That's like trying to gain more aura points, but he doesn't have to do that.
Because he already has
Because
all
he has
the
aura.
points.
Yeah. He's,
I don't mean to be a
Yeah.
naysayer, but it ain't happening.
But president?
Yes.
I'm from Georgia. I can't say things
Yeah,
like
no.
that.
Well, it's like Bashir, Kentucky, my home.
Yeah.
Yeah, it ain't happening.
I guess everybody in the Senate's running for president, though.
Yeah.
Yeah, I mean, but that's their job
Yeah.
to run for president.
It's true.
that's why they're in the Senate.
Like, what else are you going to do? Pass laws?
Losers.
Legislate.
Right. Oh, no.
Stop what
Boo.
the House is doing. Usually that's what they end up doing, mostly.
All right. Okay, we're at 19 and a half minutes, so I think it's time to wrap this up because it's now 84 degrees in this room. Any final thoughts from you all?
There's been a lot of headwinds, but there's also always opportunity for engagement. It is important, particularly if you are systems. If you're a big name, they're coming for you. That's just it. And so how do we find ways to tell the story of your organization that talks about economic growth, that talks about care, talks about dignity in work, talk about community service, so that people understand that just because you're a name doesn't mean that you are someone who is doing ill will or someone who is not serving the people. And so that's where we can help you with that in terms of setting up facility tours, doing district advocacy program meetings, and also sending grassroots letters, and also just staying in touch with your member of Congress. If you're doing something positive, if you're not sending your press release to them, please start doing those things. It's important to highlight all of the good work that you do.
It's funny, you stole my point.
Oh, I'm sorry.
You did. I wrote it.
You still like
I
three of mine.
maybe I was reading from the side. Maybe I was internalizing it. I'm sorry.
The one thing I was going to contribute today.
Sorry. we can cut that out, whatever I said, and then we
Hey,
can
Mike.
record after.
I'll just leave it at I second Lauren.
Oh, see?
Sorry.
Jamie?
Yeah, I agree that, in the healthcare world, we need our physician executives to be engaged. We
And
have
all executives.
and all executives engaged. I mean, Laura and I both worked for member organizations in the past, and I would say for my member organization I worked for, they were physicians, and they had direct access to the members of Congress because of political support and other things. And that's something that our members need to be doing. Our members are in the community already, but I think you need to be willing to get your hands dirty and talk with these people and tell them, like, your policies, this is what's actually doing the community.
And I think what you are saying is at some point, our executives have to start contributing to PACs as well.
Yes.
So, yep, okay. All right, well.
I was trying to go around it.
Well, actually, we had a member of Congress speak to the board, and he was a physician, by the way, and he was quite clear. We need to see you. We also need to see your contributions. So it is a pay-to-play system.
And it wasn't a federal building, so which makes sure.
And that is true. But at least it had air conditioning.
Yeah.
All right. I made Michael laugh. That's good. And we will wrap up today. Again, thank you all for a great conversation. Mike, I thank you for producing this and sitting in this room twice. We appreciate everything. With that, we will say goodbye and hope you all have a very good day.
Thanks for joining us for Filibusters in Fine Print. This podcast was brought to you by AMGA. For more information about AMGA's advocacy efforts, visit amga.org/advocacy.